280 million people would lose their private health care insurance, principally through business, as a staggering usurpation not only of liberty and choice, but actually completely sacrificing the efficiency of what is still a pretty good health care system. It ain't perfect, it needs reform, but still pretty good, and people pretty satisfied with it.
It's well known that the U.S. spends about 18 to 20% of GDP on health care, which is a good twice as much as every other developed country. And most polls show that people don't particularly love their insurance company. They might love their doctor, but not necessarily Aetna or Cigna. So why is redirecting that 18% from insurance premiums and payments to CVS Pharmacy to a tax that where someone else pays necessarily bad? It's not necessarily going to cost more. It's just redirecting the money.
Well, look, I've never understood. I don't know what the right amount of healthcare spending is, or what the right share of the economy is. I've never particularly understood that line of reasoning, because if you live in a prosperous economy and incomes over time continue to rise, which is really the story of the American economy, going through slumps and rebounds and so forth, people may choose more health care. It's a free choice. And I like that a lot. That 180 million number, which is a fair number, I've seen left of center, right of center think tanks come up pretty much with the same number. Those folks like their insurance policies. Now, there may be other segments in the individual side that need working on, and I was very critical of Obamacare and remain so. We've taken out the individual mandate and made other reforms, but I think the idea of just taking that away is the most remarkable government confiscation plan I've ever heard. I think the basic parts of the system are okay. We can do better, but not if the government runs it. I don't buy it.
People seem to like Medicare.
I like Medicare. I'm a proud member of Medicare, by the way. Proud member.